Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, does borderline personality disorder manifest differently in men and women? So I've seen a lot of different attempts to answer this question on YouTube and other places. And I think what happens much of the time is that the question that gets answered instead is, does borderline personality disorder get misdiagnosed? Are women more likely to be diagnosed with borderline personality disorder, and are men more likely to not be diagnosed with it, when actually, of course, they could have it? So I'm going to try to answer really both questions. Does borderline personality disorder appear differently in men than it appears in women? And is there a misdiagnosis situation where men who have borderline personality disorder are being overlooked? So they're not being diagnosed when they should be diagnosed. So let's start by going through borderline personality disorder as a construct. It's a cluster B personality disorder in the Diagnostic and Statistical Manual, so it's in the same cluster as antisocial, narcissistic, and histrionic personality disorders. And we see a variety of symptoms with borderline personality disorder, like fear of abandonment, having an unstable relationship pattern, anger, impulsivity, and affective instability. There are a few others as well. So we see that these symptoms tend to cluster together, and when they do, and enough symptoms are present, this is what we call borderline personality disorder. Now, this personality disorder is not gender specific. So we don't see a lot of gender specific mental disorders in the DSM. So these would be disorders that could only be given to a man or only be given to a woman. We see a few in the sexual dysfunction category, but really most mental disorders are available to both men and women, diagnostically speaking. Now, there could be different presentations of a disorder in men versus women, and we do see this with a number of disorders. Like, we know that antisocial personality disorder presents differently in men than it does in women. But again, we don't see a lot of gender specificity in the DSM, and we know that borderline personality disorder is kind of a challenging diagnosis to diagnose correctly, regardless of whether you're treating a man or woman. So it is a difficult disorder to diagnose correctly. It's important to remember, however, that in terms of those symptom criteria, they're not evaluated differently by gender. So we don't really have a different set of symptom criteria for a man than we would a woman. The same symptom criteria. So diagnostically, in one sense, it's actually straightforward. Of course, as I mentioned before, in another sense, it is a difficult diagnosis to get right. So to answer the question, are men less likely to be diagnosed when the symptoms are actually present? So if you had a group of women and you had a group of men and all the individuals had the symptoms of borderline personality disorder, would men be less likely to be diagnosed? The answer is yes. The research tells us that there is a bias that clinicians tend to have, and they usually would think of borderline personality disorder more readily if they saw the symptoms in a woman than they would if they saw the symptoms in a man. So what happens to men who have borderline personality disorder and they go to be diagnosed by a counselor or another type of mental health clinician and they're not diagnosed? Well, what happens to them is they're usually diagnosed with another disorder, like antisocial personality disorder, narcissistic personality disorder, paranoid personality disorder, which is actually a cluster A personality disorder. We also see ADHD, conduct disorder, oppositional defiant disorder, and intermittent explosive disorder. So we notice there that a lot of these disorders involve an anger component. So it appears that mental health clinicians are seeing the inappropriate intense anger symptom criterion of borderline personality disorder, and then taking that and looking at other diagnoses. So of course there's some overlap between borderline personality disorder and many of those other disorders. One of those areas of overlap is anger, potentially, with a lot of those disorders. So again, that appears to be what clinicians are focusing on when they diagnose men, and research has supported this. So we see that men tend to be misdiagnosed when they have borderline personality disorder, but why is this the case? Well, again, as I mentioned, it seems to be around bias, a clinical bias. And I think this is because there's a difference in terms of men and women in what we see in social acceptability, what's expected, what's normal. And clinicians are affected by this too. Clinicians will look at a man differently than they'll look at a woman. And usually that's not problematic, But in the area of borderline personality disorder, there's a lot of misinformation and there's a lot of potential here to diagnose incorrectly compared to a number of other disorders. I think what happens too is that we see a lot of the characteristics of borderline personality disorder have to do with relationships. So I think there's a bias there as well. I think clinicians are more likely to look at a woman and think that there'd be a dysregulation in terms of relationships than there would be with men. So there's a lot of different biases around this disorder, and I think the cluster of symptoms that come with this disorder. Now, there's more than just a clinical bias, though, explaining what's going on here. Meaning there is actually a difference between men and women who have borderline personality disorder. And this is the question that I see is not really addressed or answered a lot of times. People go to that misdiagnosing narrative, which again does have evidence to support it, and they skip the interesting facts that there are actually differences in men and women who have borderline personality disorder. It's not all because of misdiagnosing. So what we see here is a differential self-endorsement of criteria from men to women, meaning men and women will say they have different symptoms than each other. We see a difference there. We also see a clinician difference. So there's a differential clinical assessment of men and women who have borderline personality disorder. So there's actually fairly good evidence that there are real differences in men and women who have borderline personality disorder. Not talking about the misdiagnosis, but people who actually have the disorder. With men, we tend to see more impulsivity and more aggression. So this is men with borderline personality disorder. More impulsivity and more aggression even after controlling for differing levels of the trait by gender. We also see that women with borderline personality disorder are more likely to have relationship instability than are men. So there are two differences right there that are fairly important, but that's not the end of the differences between men and women with borderline personality disorder. We also see that with men who have the disorder, they're more likely to have a substance use treatment history. They're also more likely to have comorbid antisocial personality disorder, narcissistic personality disorder, and intermittent explosive disorder. Now I think this is particularly interesting because I think this is the area where these two questions come together. What about the misdiagnosis, and are there really differences? If you think about this, if there's higher comorbidity with these disorders in men, then it makes sense that some clinicians will see the anger symptom criterion and other symptoms and conclude that the most important diagnosis to give would be antisocial or narcissistic personality disorder or intermittent explosive disorder. So it may be really about how clinicians prioritize with women versus men. Now, of course, if somebody meets the definition, if they meet the full criteria for borderline personality disorder, that diagnosis has to be given in most situations, of course. And this is what's really being missed. Somebody's giving a diagnosis of another type, like IED or NPD or something like that, and they're not also giving the borderline personality disorder diagnosis. So I think it's more about misprioritizing sometimes than it is about thinking that the borderline symptoms simply aren't there. So it's really important here to tell both sides of the story. It's not all about misdiagnosing, and that's really what we see all over the internet in terms of the explanation with borderline personality disorder and differences by gender. So I mentioned men are more likely to have that substance use treatment history and certain comorbidity. Women are more likely to have a history of therapeutic treatment and of taking prescription medications for mental disorders. And they're also more likely to have comorbid anxiety, major mood disorders like major depressive disorder and bipolar disorder, as well as post-traumatic stress disorder and eating disorders. So again, we do see quite a few differences between men and women with borderline personality disorder, not just on the symptom criteria, but with comorbidity and a history of treatment as well. Now what's interesting here is when we take all these different symptom differences and history differences, we still see in the research literature that with men and women there are equal levels of emotional distress in terms of BPD. So it's a serious disorder whether it affects a man or a woman. The differences are important, and of course the misdiagnosis risk is important, but we do have to keep in mind that the emotional distress levels tend to be equal when we look at large samples. So understanding the differences in terms of men and women is important, but the disorder still comes with serious consequences for both genders. I hope you found this description of borderline personality disorder and gender to be interesting. Thanks for watching.